There are 3,440 Virginians on that list, and it's called a Priority 1 list. That means that those people need special health care services that can be covered by a DD waiver, and they need it in about a year or less. Now, Governor Glenn Youngkin is pledging $300 million to make that list go from over 3,000 people to zero. But some people who already receive a DD waiver have their doubts.
So today I want to tell you, first, my friends who've been on this journey with us, that I will include in the budget that I am announcing next week more than $300 million over the biennium to ensure that 3,440 people waiting on that list will receive their DD waiver.
A standing ovation for Governor Glenn Youngkin, announcing that soon more than 3,000 Virginians waiting for critical health care services will wait no more.
Well, having been advocating since my boys were born for 34 years, it's tremendous. Thank you so much.
For parents like Kim Goodlow who have children with developmental disabilities, getting a waiver to cover special services like therapy or group home care is a godsend. She waited 17 years for one of her children to get one.
We were in critical despair before Matthew got his waiver. Our family was on the brink of falling apart.
$300 million will be put toward funding waivers for all of the families who take priority.
It would take a lot.
But some families, like Canon Jeter's, worries.
There isn't enough support. It's just not there.
Our Melissa Hippolyte interviewed Jeter back in June. Jeter has a teenage son who has autism, is nonverbal, and sometimes can become violent. They say they waited years to get appropriate care, even on a waiver he received when he was 7. Just because families have a waiver, Jeter says staffing shortages mean even those with a waiver will have to wait.
I'm concerned with what that next step's going to look like for them, how many times they'll get the waiver and think they have things in place that are going to help them, just to be told there's a year-long wait list, there's a 2-year-long wait list, we don't have enough staff.
We took Jeter's concerns to the governor.
The supply of funds that will put into the market with the demands for more services will foster the creation of more capacity. We're putting a real emphasis on healthcare workforce in our entire career path and multi-path training in Virginia. So we've got lots of work to do, but the great thing is, I think we've got a lot of effort in trying to close not just the gaps on the Priority 1 wait list, but also the supply of workforce and the need for more capacity.
Now, Youngkin also announced an additional $2.3 million that would go toward electronic home-based support operations that would go to Virginian families in need. In Richmond, I'm Elizabeth Holmes, CBS 6 News.